what are the top 10 diagnoses in men over 50? Well, two of them are enlarged prostate and prostate cancer. Of course, anything related to heart disease is number one and two, but an enlarged prostate is a big, big component, no pun intended, of what men are diagnosed with after the age of 50. So PSA briefly, things that can cause a high PSA is, yes, cancer, prostate cancer, BPH, and enlarged prostate. Really, any activity of the prostate, any disturbance of the architecture of the prostate, whether it's a digital rectal exam. So when you go to the doctor, and this is one of my frustrations in clinically, you should never get a blood draw after a digital rectal exam. The digital rectal exam should come after the blood draw. And I see a lot of practitioners sort of not getting that right. When you do a digital rectal exam, this is causing a little bit of disturbance depending on how rigorous the rectal exam is of the prostate. That's going to cause PSA to rise. So that will cause PSA to rise. Ejaculating within, let's just say 48 hours will cause the PSA to rise. Why? Because when a man ejaculates, the expulsion of the semen is from the prostate, actually from the muscular part of the prostate. That is the function. It squeezes and it brings out the semen. But that causes some kind of disturbance of the architecture of the prostate, and that will cause the PSA to rise as well. Prostatitis, any inflammation of the prostate, or some sort of infarct where there's not enough blood flow going in to the prostate will cause that. So the PSA is produced in the glandular part of the prostate. There's some PSA that seems to be secreted, a molecule that resembles PSA in a salivary, in a saliva, or in breast tissue, found in semen, urine, and blood. And what it does is a protease, which means that it's an enzyme that liquefies semen. So when a man ejaculates, they expel semen, but semen quickly coagulates and clumps up, similar to blood. So the purpose of PSA is to liquefy the semen so that the sperm cells can be released and move freely for conception. But we know that PSA is poorly sensitive to prostate cancer and not so specific to prostate. So this notion of using PSA for prostate cancer screening has been debatable within the last 7-8 years. Okay, now there's better things out there, but PSA is still a very good bio, and we're going to talk about that in a second. But the bottom line is, with this slide, is that PSA in terms of being used as a diagnostic tool for prostate cancer, there's just a lot of evidence that within the last 30, 40 years, it's been overused and abused and misused. So now we've had people who've been treated for prostate cancer who never should have been treated, and we've had biopsies on people that should never have been biopsied for prostate cancer. So it's a poor biomarker for prostate cancer. I would say that it's not to be used. So I disagree with the notion of let's just not use PSA at all. I disagree with that notion. But it's a matter of how you use the PSA biomarker, not using it. So just you get a number back, that doesn't mean right away biopsy. You use that number as a totality of a bigger picture to try to figure out if the patient has prostate cancer or not, or there's something going on in the prostate that's unrelated to cancer. And some of the ways to improve sensitivity includes PSA velocity. So that steady increase in PSA number within 3 to 6 months is valuable information. Also, it's age dependent. So this notion of 0 to 4, when you look at lab tests, where it says the normal range is from 0 to 4, is nonsense. Because if you're 45 years old and your PSA is 2, that's 2.5. That's high for 45 years old. If you are 60 years old and your PSA is 5.5, then that may not be a high number. So just the absolute value itself of that number, it's not that great. And only about a quarter of prostate biopsies reveal prostate cancer. Even if there's prostate cancer there, when the PSA is used to as a screening tool. So it's imperfect, but there's ways to improve its sensitivity and specificity, age adjustment, velocity, free PSA. You also see in a lab test, you see free PSA as another tool, free PSA percentage. So anything under 25, the lower the number, the higher the likelihood, but there's a lot of false positives there as well. And then PSA density. PSA density is a calculation where you get the size of the prostate and you divide that over the PSA value and it gives you a number. Anything above 0.15 indicates that there's probably prostate cancer there. So the bottom line here is PSA is a decent tool. I use it, but I use it very carefully. And of course, when patients come see me, I don't want them to get a biopsy unless they absolutely need it. And so we go through all the steps to figure out if they need a biopsy or not. Last thing I'll say is the gold standard way to diagnose for prostate cancer is through a prostate biopsy. There's no other way. So even though there is great technology and MRIs and scans and PSMA scans and PET scans out there, none of these are tools that are used to diagnose someone with prostate cancer. You have to get a biopsy. There's no other way. So my goal is, again, in terms of my assessment, is to look at many things to figure out if the patient needs a biopsy or not. And oftentimes I gather all the information to determine if they need it or not. So. Okay, we talked about its poor sensitivity. Sensitivity of biopsy screened is 60 to 80% at best. This notion of the cutoff being 4.0 is not an absolute indication for a biopsy. So we gave you several scenarios already, but let's just say a 53-year-old man with a PSA of 4.5, that will not prompt me to suggest for a biopsy. So there are many factors there. And there's many scenarios that would cause a rise in PSA. Catheterization, if you're catheterized, that will cause a high PSA, an increased rise in PSA. So there's a lot of, I think stress can cause high PSA. I typically get men to sort of do 5 deep diaphragmatic breaths before their blood draw, so that, despite the fact that this number is it's been shown to be imperfect for prostate cancer, the men still stress over PSA. It's just what it is. It's a psychological thing, and so it's a decent thing to try to keep that number down. And that number does tell me something about prostate health, not just prostate cancer. So it may be inflammation and so forth. So typically with the natural protocols that I prescribe, the number of PSA can be lowered significantly, I think, which again signifies prostate health, not just as it relates to prostate cancer. All right, here we go. So PSA density, we spoke about. Anything above 0.15 is associated with prostate cancer. Then we look at PSA velocity. Roughly, if PSA increases more than 0.75 a year, that's something to focus on. Roughly, it depends on many factors. Then we have PSA free percentage. Anything lower than 10% is more likely to be prostate cancer. Anything higher than 25% is more likely to be related to a big prostate. And then there's age-specific thresholds.